Welcome to the Neuroscience Education Institute podcast. I am Dr. Sabrina Siegel, and I have here with me today our guest, Dr. Roger McIntyre, and we are going to be discussing inflammation, metabolism, and depression.
Sabrina, wonderful to be here. The topic of inflammation, metabolism, and depression has in many ways become one of the hottest topics in neuroscience today. Now, quite frankly, this would be an example of, in Star Trek, they said boldly go where we've never gone before. Well, this is boldly going where we actually have gone before, insofar as historically in neuroscience and psychiatry, there had been many observations that disturbances in inflammation or immunity, as well as disturbances in metabolism, might be relevant to why people suffer from mental disorders, and also it may in fact be a method of treating mental disorders. That thought and that whole line of thinking in general was dormant for much of the last 6 to 8 decades, but it's now come back. And there are in fact many lines of evidence that give us indication that for some people, not everybody, but for some people who have chronic, severe mental disorders like schizophrenia, bipolar disorder, major depression, autism, the list keeps going, that something is wrong with their immune system. In other words, their body's endogenous defense mechanism, which is there primarily to fight what I call pathogens, predators, and people. What I mean by people is tribes. And we have this immune system that's been wired for us to preserve our body integrity. But nowadays, unlike millions of years ago, our greatest threat is not a predator. Unlike 100 years ago, our greatest threat is not an infection. And presumably in civilized society, we're not engaged in tribal warfare, although that's occurring in some parts of the world. But the point I'm getting at is that the immune system is now believed to be activated by stress. And what is affecting humanity today? Well, we have people under economic stress, housing stress. People have stress as it relates to their daily lives and managing their day-to-day activities. We also know that people's diet has changed. Sleep patterns are absolutely changed. People are sleeping less than they once did. Social integration, the paradox is that notwithstanding social networks and all kinds of online opportunities to engage people have never rated their social isolation so high as they do now, which is so interesting. And so taken together, stressors activate the immune system, and it's now known that when the immune system's been activated, one of the consequences of that is that people begin to have symptoms of mental illness. The other part about this, which is really, really interesting, is that for many, many people who have depression or bipolar or other mental disorders, they have comorbidities. And comorbidities are not just common, but many of the comorbidities also share in common with the mental illness, inflammation, obesity, diabetes, heart disease, arthritis, inflammatory bowel disease. The list keeps going. We have many medical conditions which affect psychiatric patients at a rate much higher than would be expected by chance. This is not coincidental. The reasons that people have these conditions co-occurring is because there's something wrong with the immune system. In other words, not only did the immune system result in a problem above the neck, but also a problem below the neck in terms of their physical health. So studies have been done in many different populations of people who have mental illness, showing in fact that there's different measurements in the blood of immunity that are just not right, such as hsCRP, C-reactive peptide. We have other types of categories of proteins called cytokines and chemokines. But the message I think I really wanted to convey is that we have what we call a pro-inflammatory balance. I want to emphasize pro-inflammatory balance because we know that for many members of the inflammatory system, we have good guys and bad guys. So within the inflammatory system, some of the proteins are there to serve us benefit, while others could possibly do us harm. And this is normal homeostasis, and in mental illness, that shift is towards a pro-inflammatory balance towards the harm. One of the interesting philosophical questions I've always been interested in is, if depression is such a bad condition, how come it's survived thousands of years? Why doesn't it go away? And there's reasons to believe that in part the reason why it's surviving is that in evolutionary terms, people who had the most robust, the most dynamic and immune system capable of adaptation were the individuals who were most likely to survive. They would fight infections and heal their wounds. Consequently, though, in modern society, these individuals are now prone to having depression. Secondly, I've always wondered why there's been such an uptick in the diagnosis of allergies or inflammatory conditions or autoimmune disorders. And this seems to correlate with urbanization and, in fact, greater sanitation. There has been a proposal that what's occurring is that because we're increasingly promoting a sanitized lifestyle, particularly for children, they don't have the ability to beef up their immune system through exposure to environmental pathogens that actually allow some of the good guys to grow and consequently leaves them at risk of a variety of conditions. Where does this leave us? Where this leads us is the following. We know that mental disorders are conditions with complex causes. And there's not one single cause, and there's dynamic interplay between inflammation and other systems that have been implicated, like disturbances in dopamine or serotonin. Inflammation is also relevant to oxidative stress, and is also relevant to how the brain is integrated. So we have many different physiologic systems that are in interplay, but for some people, disturbances in inflammation may be the principal reason why they have declared mental illness. Does this mean that there's a role for anti-inflammation? In other words, immune-based therapies for psychiatric disorders? Well, the answer is yes, it does. And I want to just expand this because we know that if you have behavioral interventions, such as sleep hygiene, or a behavioral intervention like being in supportive psychotherapy or a good psychotherapy, that's been shown to be anti-inflammatory. In other words, people have reductions in the bad guys and increases in the good guys within the immune system. Other modalities of therapy, like exercise or neurostimulation, have also been shown to be anti-inflammatory. What's really interesting is that many of the pharmaceuticals that we prescribe for brain-based illnesses, like antidepressants, lithium, many others, also possess anti-inflammatory properties. But what about conventional anti-inflammatory agents? Medications that we would think about to treat pain or to treat an inflamed joint? Well, we've got evidence now that would indicate that some of these medications, like COX-2 inhibitors, omega-3 fatty acids, and other medicines that are indicated for disorders characterized by disturbance and inflammation, are also in possession of properties that would benefit psychiatric illness. For example, studies have shown that drugs that are for inflammatory bowel disease or drugs that are there for psoriatic arthritis could improve people's mood state. We have evidence that some antibiotics may actually reduce negative symptoms in schizophrenia, improve cognition in mood disorders, and reduce the severity of the depression. So the science around immunity in the brain is not only of academic interest, but what the idea here is to provide for patients treatments that are not just novel, but treatments that are targeting the underlying disease process and could offer patients modification of the disease state, maybe even cure the disease state, rather than just suppressing the symptoms. So this is an exciting time. The technology and tools we have now are going to provide surreal opportunities for us to better unravel some of this pathogenetic relationship between immunity and the brain. And our hope is, going forward, we will invent or repurpose drugs that can be very novel for our patients.
That sounds very exciting. Thank you so much, Dr. McIntyre.
Thank you for having me.
Thank you for tuning in to the Neuroscience Education Institute podcast.